Tracy?
Yes, I am.
Hi Tracy, I'm Mike, one of the students. I'll be following you around today, if that's okay.
Sure.
Can you give me a SPAR on your patient you're about to see?
Sure. We are going to see Marta Yarn. She is in room 529. She is a patient of Dr. Jolly's. She is 80 years old, and she came in for surgical debridement of a non-healing stage 3 sacral ulcer. They tried treating it as an outpatient, but didn't have much luck there. She is slightly hard of hearing and has a history of dehydration and pneumonia. She is alert and oriented ×3. Vision is 20/40, and she has some generalized weakness, which she uses a walker for when she walks. And she does complain of some low back pain. She says it's achy, but it is relieved with Tylenol. She did report earlier a pain of 6 out of a 0 to 10 scale, and she received some Tylenol for that. And we'll double check when we go in there and make sure she's been relieved. For respiratory, she has diminished breath sounds in the bases, but the rest is clear, and she denies any chest pain or shortness of breath. Heart sounds are good, S1, S2. Everything is within normal limits, and an ECG has been ordered for the debridement tomorrow. She has said that she's got decreased appetite, but denies any pain. Her abdomen is soft and non-tender, and she's got bowel sounds in all 4 quadrants. She's on a regular diet, but will be put in PO at midnight for the procedure tomorrow. And a dietary consult was ordered to help her to obtain more protein in her diet. She denies any urinary problems except for occasional stress incontinence, and has no problems with her bowel habits. For integumentary, she's got poor skin turgor and complains of it being dry and scaly, so we will get her some lotion to put on to help with that. Like I said, she does have a stage 3 ulcer on her sacrum, and we are to cleanse that with normal saline and put a hydrocolloid dressing on it. Her IV is in the right dorsal metacarpal and is a 20 gauge. Last I checked, it was patent with no redness or swelling. Her vital signs are Q4, and her last blood pressure was a little high at 144/90. O2 sat was 92, and heart rate was 88. We will be going in to give her gentamicin for the infection in her sacral area, and she's also receiving continuous normal saline with 20 milliequivalents of potassium that we will also hook up for her. Also, her WBC count was 12,500, and she was, and her potassium was at 3.6, which is at the low end of normal, which is why the doctor decided to give her some potassium. Do you have any other questions?
Yes. Why specifically is this client receiving this medication?
Well, she's receiving it due to the infection in her sacral area. Her culture was positive for E. coli.
Okay. What action does the medication have on the body?
Well, it is an anti-infective, and it inhibits the protein synthesis of the bacteria, causing it to stop reproducing.
Okay. When should you question administering this medication?
We would question this medication if she had any previous allergies to aminoglycosides. If she was on penicillin, we wouldn't want to give it as well. And also if she had any kind of renal insufficiency.
Okay. Does this medication have a therapeutic serum level?
Yes. It has a peak and a trough, and the peak would range from 5 to 10, and the trough from 2 to 4. The trough we will draw approximately 30 minutes before we are to give the next dose, and we will not give it until we get the results back from that, because that could determine whether we are going to hold the dose or decrease it, depending on what it is.
Okay. Which vital signs must be monitored?
And because she does have an infection, we want to make sure to monitor her temperature and her heart rate, and also her blood pressure, since she's been running a little high.
Okay. And which physiological parameters should be monitored when the medication is being administered?
This medication can cause ototoxicity, so we want to make sure that we keep a special watch on her hearing. Since she already has some diminished hearing, we'll have to pay special attention to that. We will be looking at intake and output. She'll be on daily weights, and we will be assessing for her renal function with lab tests, BUN and creatinine.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
For here, we want to make sure that her IV is patent, that it's not swollen or red, and that she doesn't have any pain in it. We also want her to inform us if she has any signs and symptoms of like a superbug, which would be like diarrhea. C. diff is one of the main superbugs that they can get. So we want to pay close attention to that.
Okay. And what interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Same thing, just to make sure that we have a patent IV, that she lets us know if there's any problems with signs and symptoms of a superbug. And with this medication, she probably won't go home on it, but if she was to go home on an antibiotic, we would also want to make sure that she finishes it all. A lot of times people will start to feel better and they'll stop it, and that's not a good thing, so we'll give her that information as well.
Okay. What are the side effects and potential adverse reactions?
Possible side effects, again, is with ototoxicity. We want to make sure that she doesn't have any more decreased hearing loss, tinnitus. We will be checking her kidney function because there is a chance of nephrotoxicity. So we'll look at BUN, creatinine, and also we'll want to make sure that we are checking her for muscle weakness. She does have some muscle weakness, but this can cause muscle paralysis, so we'll be checking that as well, doing range of motion.
Okay. How will you know that medication has been effective?
We'll know based on primarily lab results, if her WBC count comes down, and also if they do another culture of her sacral area, if it came back negative.
Okay. All right, that's all the questions I have for now.
Okay, well, let's go in and see Miss Martha. Hi, Miss Yarn. I'm Tracy Mitchum. I'm your nurse for today, and I have Michael here with me as a student nurse. Is it okay if he comes in with me?
Yes.
All right. Can you tell me your name and age, please?
Marta Yarn, 80 years old.
Great. Now, do you have any allergies?
No.
Very good. I don't see any allergies here in the MAR either. Okay. I have some medications to give you. One is a saline with a little bit of potassium in it, and the other is your antibiotic.
Okay.
Now, earlier when I was in, I had asked you, or I talked to you about what to look for if your IV was starting to go bad, and I gave you some signs and symptoms. Can you tell me what those are? Do you remember?
If my IV feels hot or swollen, or if it's red or painful.
Great. Yes, that is right. Now, is it feeling okay now?
Yes, everything's fine.
Okay. I'm just going to take a look at it. All right. Yeah, everything looks good. No redness or swelling. You said there's no pain, so I'm just going to flush it and make sure everything's moving good. We'll clean the hub for 15 seconds. Alright, and it's going smoothly, so it looks good. Okay. Alright. Now when I got this, these medications out of storage, I went ahead and looked up the reference ranges and all for them. I spoke to the pharmacist to make sure that everything was good with the patient receiving this, and he said that we were good to give the medications. And I also checked the MAR to make sure that it was the right time, the right route, the right amount, that it was the right medication, right patient, and also on here I check for expiration date and make sure that it is clear without anything floating in it, and make sure that that we have the right dose as well. And it looks good again. This is my second check. And my barcode scanner isn't working, so I will get the number off of your band. Okay. And go ahead and get it off my medication. Okay, you can see it gave me the green light. And I'm just going to get my tubing together. Now with this, you want to make sure that we don't contaminate the spike or the opening to the bag. And of course, we want to make sure that our tubing is clamped, which I made sure it was before I hooked it up. Now I'll go ahead and prime my tubing. Okay. And because we do not have a pump, we will be using the dial of flow. It's new, I don't have to scrub the ends of it, I just need to attach it. And then I'll need to prime this line as well. that's primed. I need to document the time and the site that I put it in, and that it will be running at 125 milliliters an hour, and put my initials. Alright, and then I will need to do the same with the gentamicin.
Where's your room? I need to check the room. And where's all your stuff? The alcohol,
And the same with the gentamicin. I had already talked to the pharmacist about it, made sure that it was safe to give and that it was the appropriate dose. I checked for the right time, the right amount, the right drug, make sure it was the right patient. And also make sure that it's not expired, that it is clear, and that there's no tears in the bag. I'll go ahead and enter this one in.
don't lie. No, for real. Yeah, I was the other group I was here before.
There we go, and you can see I've got the green light. And we will be hooking this up via piggyback. And when we do this, we have to lower the main line down. And for our second check, I want to make sure again that it is the right dose, the right amount, the right time, the right drug, the right patient. Can you tell me again what your name and age are?
Marta Yarn. I'm 80 years old.
Okay. Very good. Okay. Again, for this one, we want to make sure that we don't touch the ends together. And of course, want to make sure that it is clamped, which it was. You've got to be very careful when priming this tubing that you do it nice and slow. Okay, didn't take long to do that. We'll need to scrub this hub for 15 seconds. We will be setting this, check again, and it is at 100 milliliters an hour. So I will make sure my dial flow is set to 100 milliliters an hour. Okay, and just going to check the MAR one more time to make sure that it is the right dose, right time, right route, right medication, and patient. Okay, and they are both good. I'm just going to clean the hub here for 15 seconds. Take off my cap. And my diaflow is, again, I'm going to check to make sure it is at 100. And I will go ahead and open up my clamps so that it can run. And then I will watch to make sure that I have 5 drops before I leave, because I want to make sure that it is running, that there's no kinks or any problems with the line. And I will need to set an alarm to make sure that I come back between 50 and 55 minutes to make sure that it's all gone in, and can change the dial of flow to the amount per hour that the main line's supposed to go in at. And we'll check back frequently to make sure that it's going in the way it should. Alright, take these up. And I've got my labels for my tubing. Seemed to have lost the other one I did, so I'll just make another one. As long as it's on there, we want to make sure that the date and the time and our initials are on it. Okay. I also want to make sure that I finish documenting this in here as to where the site that I gave it, what kind of needle, and that it is running at 100 milliliters an hour. And make sure I put my initials and save it. Okay, and this yarn,
Yes.
earlier I had talked to you about your sacral ulcer and how some ways that you can prevent it. So I brought you some information that I'll have you look over, and if you have any questions whatsoever, feel free to let me know, and I'll come back and try to answer any questions that you may have.
Okay, thank you.
Is there anything else I can do for you?
No, I'm fine.
Okay, and I'll see you in just a little bit.
I just had a couple more questions before I go, if that's okay.
Sure.
I was just curious, were there any pertinent pieces of information you reviewed before administering the client this medication?
Yes, we wanted to look at the trough results, because that could determine whether we gave more or less, or whether we would hold the medication, and also wanted to look at her renal function, so her BUN and creatinine.
Okay. Did this information affect your decision to administer the medication?
It would have if it had been high or low, but I did check with the pharmacist, and he said that everything looked good to be able to give the medication.
Okay. Did this information affect how the medication was administered?
No, it didn't affect how it did.
Okay, thank you. That's all I had.
All right. Well, I'm going to go ahead and finish documenting some information if you'd like to watch it.
Sure. Thank you.